Hi guys, my name is Niyati and welcome to this Chegg video tutorial. In my last video I spoke about what congestive heart failure is and just gave you a brief kind of an introduction to a heart failure. And so in this video we're going to talk a little bit about the symptoms and signs of heart failure depending on what side is affected, left side heart failure versus right-sided heart failure. So as you can see in this picture here, left-sided heart failure symptoms are somewhat different from the right-sided heart failure symptoms, and the differences occur because of where the blood is getting backed up in the body. So as you already know from our basic general knowledge of anatomy and how the blood flows in the heart, blood from the left ventricle is supposed to be ejected out from the left ventricle into the aorta and then to the systemic circulation. Blood from the right ventricle gets ejected out into the pulmonary artery and then goes into the lungs where it is oxygenated in the pulmonary capillaries subsequently. The alveolar capillaries in the lungs. So when there's left-sided heart failure, what happens is that the blood from the left ventricle isn't sufficiently pumped out enough into the aorta. So all that blood gets backed up from the left ventricle into the left atrium and then into your lungs because the blood is returned from the lungs via the pulmonary veins into the left side of the heart, into the left atrium. So when the left ventricle isn't contracting properly, your blood gets backed up into the left atrium and then the pulmonary veins and then the lungs. So your lung vasculature becomes, there's a lot of blood just that is backed up into the lungs since there's no forward flow out of the left ventricle into the aorta. So that is one of the reasons why that's the reason why it's called congestive heart failure, is because of the pulmonary congestion that happens. The main thing now that's happening in right heart failure is that we know that blood comes into the right ventricle from mainly your superior and inferior vena cava, which empty out into the right atrium and then subsequently into the right ventricle. So these are the two large veins of the body that basically bring in blood from the lower extremities and the lower half of the body and the head, neck, and the upper half of the body. So when your right ventricle is not contracting properly, or when you have right heart failure, your right heart is not pumping the blood effectively into the pulmonary arteries, so that blood is not getting pushed forward into the pulmonary arteries for oxygenation into the lungs. So what's happening now is that instead of being backed up into the lungs, your blood is now backed up into where it's coming from. So your blood, instead of moving forward from the right ventricle into the pulmonary artery, is now getting backed up into the right atrium, subsequently into the inferior and superior vena cava, and mostly into the inferior because of the effects of gravity. So you have blood pooling basically in your legs and your abdomen. So these are kind of the two major differences as to where the congestion and pooling of blood is happening in left-sided heart failure versus in right-sided heart failure. In left-sided heart failure, you have a lot of the pooling and stagnation and congestion of blood happening in the lungs, whereas in the right side heart failure, you're having the blood that's just kind of stagnating and hanging out in your lower extremities. So the differences in symptoms are mainly these two, and the rest of them are kind of overlapping. So in case of left side heart failure, as you can see here, you have something called PND, or paroxysmal nocturnal dyspnea, which is basically a $5 word for episodic breathlessness at night, which means that every now and then the person will wake up feeling breathless at night, having to gasp for air, and that's because of that is often accompanied with orthopnea. So orthopnea is basically a feeling of breathlessness when you're lying flat on your back. And the reason this happens is because when you lie flat on your back, the venous return to the lungs or to the heart increases. And when you have increased blood pooling in your lungs, that's going to cause breathlessness because of all the congestion and the ineffective oxygen exchange that's happening in the lungs because of this congestion. So imagine you are kind of like a test tube filled halfway with water. And then when you turn this test tube sideways, the water is going to move towards the top of the test tube. So similarly, when you're standing up, because of gravity, a lot of the blood is towards your feet, or your lower half of your body. When you lie down, that blood kind of shifts up to your heart and to your chest. And in heart failure, when your left heart is unable to pump that blood coming from the lungs, when it's unable to pump it into the aorta, into your systemic circulation, that blood is now going to get backed up into your lungs, which causes breathlessness. So that's known as orthopnea and PND together. Because of these symptoms, you develop pulmonary, or rather, these symptoms are developed because of pulmonary congestion. And when you examine the patient in these cases, they might tell you that they have a cough, and you're going to hear crackles and wheezes when you listen to their chest on auscultation. There may even be blood-tinged sputum as a result of all that blood getting backed up, and that's going to lead to increased pressure in the lungs. And if that causes rupture of the capillaries, then that can lead to blood in their sputum. Along with that, you have symptoms of basically decreased perfusion or decreased oxygen supply to organs like the brain, which can lead to confusion or restlessness, or just fatigue, where you feel tired all the time because your organs are not getting enough blood because your heart is failing. You have exertional dyspnea, as you can see written right here, which is basically breathlessness on exertion or during exercise because your heart is unable to keep up with demand. So these are some of the symptoms of left-sided heart failure. Coming to right-sided heart failure, your symptoms are a little bit different in the sense that, like I said, you have the blood pooling in different areas. So in case of right-sided heart failure, your blood that's supposed to come from your extremities and upper body to your right ventricle is not pumped effectively into the pulmonary arteries for oxygenation. So that blood gets pooled into your lower extremities. So that basically causes lower extremity edema or swelling of your lower extremities in your feet. It also causes ascites or buildup of extracellular fluid in the abdomen. So ascites and pedal edema are common in case of right-sided heart failure. You also get what's known as you can get tender hepatomegaly, which is basically where you have your blood that's pooling in the veins of your liver. So that causes hepatic congestion, and in the spleen. So that's what causes enlargement of the liver and spleen as well in the right-sided heart failure. You get what's called distended jugular veins, which, like I said, is because of all the blood pooling up towards your head end as well, not only towards your feet. So you have your venous pressure that increases in your venous column in the neck, causing distension of the jugular vein. This is often an indicator of your volume status. So if a person is volume overloaded, your jugular veins will be distended. And a lot of the time when the person is dehydrated or volume depleted, you'll have the JVD will be, or the jugular vein will be collapsed. So that's often used as like an indicator for, or not really an indicator, just as kind of a sign to tell you the volume status of the patient. You also have weight gain, and weight gain primarily because of the extracellular fluid, the ascites that builds up, or rather the fluid that leaks out of your blood vessels as a result of increased pressure. So since your heart is unable to beat that blood forward, the blood kind of stagnates there and increases pressure in the blood vessels, and that pushes out your lymphatic fluid into the extracellular space, and that results in what's known as third spacing, and you basically gain weight as a result of that fluid. So weight gain is another common symptom of heart failure. Dependent edema, meaning edema that develops in your dependent areas of the body, which is basically your legs and areas that are under the effect of gravity. So that's what you mean by dependent edema. And as I said before, general symptoms of insufficient perfusion to the body, fatigue, which is common in any type of heart failure, whether it's left side or right side, so yes, these are basically the two differences between your symptoms of right-sided and left-sided heart failure, particularly the lung findings on the left side because of the congestion, and your findings of edema and your pedal edema and your abdominal distension, and JVD, which is jugular venous distension on the right side. The right heart failure may also be secondary to or caused by a primary pathology in the lungs. So if you have a primary respiratory pathology or something that's happening in the lungs, like fibrosis or a tumor or something that's increasing pressure in the lungs, or pulmonary hypertension or something like that, which is causing increased pressure in the lung vasculature, then your right heart is going to have to pump harder to get blood from the right ventricle into the pulmonary vasculature. So this is another cause of heart failure. Most commonly, right heart failure is caused as a result of left heart failure because your pressure is building up all the way back. Like I said, when you have left heart failure, your pressure builds up in the left. Your blood is not pushed out of the left ventricle into the aorta, so you have blood pressure backing up from the left ventricle to the left atrium, then your pulmonary veins, then back into your pulmonary vasculature, pulmonary artery, and then subsequently into your right ventricle. So usually right ventricle failure occurs as a result of left ventricle failure. Sometimes the right ventricle failure can occur as a result of a disease that starts in the lungs, like I said, fibrosis or a tumor or pulmonary hypertension. This has another word for it, and this is called Cor Pulmonale, which was written right here, but I erased it because not all types of heart failure, of right-sided heart failure, are going to be Cor Pulmonale. So Cor Pulmonale is basically a specific type of heart failure, right heart failure, that occurs secondary to a primary disease process occurring in the lungs. So when you have left heart failure and then that subsequently leads to right heart failure, that's not Cor Pulmonale. So Cor Pulmonale is a specific type of right heart failure. And then again, common symptoms for both, like restlessness, confusion, feeling tired, fatigue, loss of appetite, anorexia. You can get GI complaints, just overall not feeling great as a result of not having enough oxygen to your body. So these are basically a bit of the similarities and differences between your heart failure signs and symptoms in right heart and left heart failure. I hope this helped. In one of my next videos, I'll be talking to you about how you diagnose, a little bit about diagnosis of heart failure, and then management, intervention, and treatment of heart failure. So I hope this video helped. I hope you liked it. If you have any more questions, my link to my Chegg Tutor profile is down below, where you feel free to ask me any questions. And I hope you enjoyed this video. Thank you so much for watching, and have a great rest of the day. Bye!